Since Glenn and I are both new, I know there is time in the meeting to elect the chair, but I just want to make sure no one's waiting on one of us to call the meeting to order, since neither are chair yet.
Yeah, well, you're here, I mean, I can call it to order, I guess, that's, and then we can go from there. Are there any additions or corrections?
There are none.
All right. Should go to public comment period, if there's any item anybody wants to discuss that is not on today's agenda. In the room, yes, go right ahead.
Should I speak here? Or should I
Right there's fine, sure.
Okay, so yeah, thanks for having me, and I appreciate everybody here in the room. So there's this Monterey County Youth Center. I don't know if you guys are familiar with it, but it's way understaffed, right? And it's run by the county. Now we have a juvenile hall, brand new juvenile hall, that's way understaffed as well. So I just think it would make sense if maybe people considered maybe consolidating the two, maybe putting the kids in the youth center at the juvenile hall and utilizing that building for the homeless people, you know, or for some other kind of resource, because it doesn't make sense for us to have two facilities. And I don't know what the budget is for the Monterey County Youth Center, but I taught a media class there last year, and I was pleasantly surprised by how understaffed they were, because when I was a youth, I was in that Monterey County Youth Center, and there was around 150 kids, I think, 160. So to now that there's only 30, I mean, I felt super good about that, to know that's where we're at, to where the crime rate is that low, to where there's not really a need like there was in the past for that facility. So I just want to propose the idea, and maybe people have thought about this idea, but I just don't think it makes sense for us to spend all this money on two juvenile facilities when they're both very, very under capacities. We're not staffed, but under capacity. You know, like I said, they spent, I don't know how many, $100 million on the brand new juvenile hall or something like that. And if they're way under capacity, then like I said, it doesn't make sense for us to have two facilities just burning money when we can just put them in one. So I think something like that facility, I mean, they have a garden, they have a basketball court, they have portables. I mean, it's a pretty good size facility to like tackle part of the problem that we have in the county with homelessness. Those are a lot of beds that people could be at. I mean, even homeless residents with pets could be there. You know, I mean, it's just an idea that I just wanted to throw out there, and I just wanted to put it on the record that this is something that, you know, like I said, people might have thought about this already, but maybe not. So that's why I wanted to show up and just give that idea, and that's all I have to say about that. Thank you for everybody's time. I appreciate you guys.
Would you like to share your name for the record?
My name is Daniel Munoz. Yeah, I'm Salinas resident, District 1.
Do we have anybody else? Thank you for your comments, by the way, Daniel. We don't see anybody online, don't see anybody in the chamber, so we moved in on to appointment of chair and vice chair. And I know Director Daniels and I have another committee coming up here too. Do you want to be chair on this one? I'll be vice chair. I don't know why we have vice chair, it's only two people anyway, but.
Yeah, I'm happy to serve as chair of this committee.
All right.
Would you like me to well, I think we provide consensus.
Yeah. I think
Looks
so.
like that has been moved, and you're the vice chair. Would you like me to take over then?
Please
from this
do.
point on? Okay, thank you. And so at this point, we have item number 2, the approval of action minutes from the October 20th, 2025 meeting. Are there any public comments on the minutes from October 20th?
None on
Okay.
board.
Supervisor Church, any comments?
No,
Or
no.
move to approve?
I wasn't there, so I'm happy
Not-
to move it. It looks all good to me since I don't know anything about it.
Okay, moved by consensus, thank you. Item number 3, there is a discussion on the agenda of the committee schedule.
Chair, Supervisor Daniels, Roderick Franks, Director of Social Services for the County of Monterey. This is an item where it would be helpful to have the input of both the chair and the vice chair in determining the schedule of meetings. Historically, this committee has had a varied meeting schedule, going from meeting every month to meeting quarterly. And so our experience has been that meeting monthly has created a little bit of administrative burden and a lot of repetition for the committee. However, meeting quarterly has created some very long meetings because the items seem to back up and pile up for the committee to address. Our recommendation as staff is to initially adopt a committee schedule of meeting every other month, and then we can determine how the committee item load looks.
I'm happy with that.
I'm happy with that too, and generally, the Thursday time works for me. The Thursday mornings do work. I don't know if Supervisor Church would prefer a 9 a.m. start to an 8:30 a.m. start, but the Thursdays, I don't have any regularly scheduled committee meetings at this point, with the exception of the one that's coming next, which will be my first time at that one as well.
9 a.m. is a little better, but a little more time for coffee to kick in, but if we got to do 8:30, that's okay.
Roderick, how does that feel for guidance? Does that work?
Yep, that sounds good. What we'll do at this point is look at the calendars and determine the appropriate dates, adopting an every other month schedule. And then we'll get that published out to you both for your consideration as soon as possible.
Great, thank you. All right, we'll consider that discussed and move to the regular agenda. Item 4, and this item is a presentation on the Health Department's Behavioral Health Bureau Community Assistance Recovery and Empowerment Act program. And I believe it will be Melanie Rhodes, Fabricio Chumbo, and Kelly Moulton, and Cassandra Shaw.
Yes, good morning. Good morning, supervisors. Thank you so much for hearing this agenda item. And Melanie Rose, Behavioral Health Bureau Chief, here with a number of staff. Kelly Moulton was not able to be here today, so it will be myself, our Assistant Bureau Chief, Fabricio, and Cassandra, who will be presenting on this item. I do want to acknowledge that the CARE Act is before you today for an update. We previously presented to the board on CARE, but wanted to bring this back now that we've been live for, 15 months now with the CARE Act, and there's been some updates through SB 27 that have expanded and made some substantive changes to CARE Act as we've known it and started it and implemented it. That went into effect January of this year that we just wanted to bring to your attention. We do have partners who should be joining us online. Sarah Solano, our public guardian administrator conservator, is joining us online. I believe Kristen McDonald from County Council will also be joining online. She represents behavioral health in CARE Act court proceedings. And then we also have Michelle Wooden from the Public Defender's Office, who is also a key partner in CARE Act implementation, as their office represents the respondents in these cases. So I just wanted to acknowledge and thank our partners for being here early today as well. And if we can go to the next slide. I want to start by level setting and just a little bit of reminders for folks, because I know it's been a bit since we've talked about CARE Court here, and just kind of overview like how we got here today. So the CARE Act or CARE Court, it's a civil, not a criminal court process. So really important to just make sure that's really clear. This is meant to be helpful, an engagement tool to help folks get in and connected to treatment. And really where it fits in the continuum of care is somewhere in between our traditional, typical voluntary outpatient services and something that is more structured and involuntary like LPS conservatorship. So CARE Court is kind of in the middle of those things. As a court-supervised voluntary treatment type program. And so in preparation for our go live, because Monterey County has been live with Care Court since December 1st of 2024. In preparation for that go live date, a Care Court Planning Committee was convened by Monterey County Superior Court Judge Culver. And we had monthly meetings starting in January of 2024. We had some ad hoc work groups throughout the year. We had a mock trial, walking through procedural things. This was a huge, like a new program. The planning committee included several key partners from court, self-help, behavioral health, public defender, DA, public guardian, conservator, also stakeholder groups came and were involved. And then of course we worked closely with our health management associate consultants. So there was a lot of effort and collaboration that went into preparation for go live in December. And so SB 27 went into effect, as I said, January 1st, 2026. And you know, what that did was made some substantive changes to the initial CARE Act, expanded criteria a little bit, and then also provided more direct pathways for referrals from other court processes. So we will highlight some of those. Yeah. So there's that overview of some of those high-level overview of the major changes, which we will walk through right now. Next slide. Next slide. So the first one of those was the addition of bipolar 1 disorder as an eligible or qualifying diagnosis, where previously it was initially limited to schizophrenia spectrum and other psychotic disorders. SB 27 expanded the eligible diagnoses to include bipolar 1 disorder with psychotic features, and, you know, except as psychosis relates to intoxication, right? So there still needs to be some teasing out of that diagnosis, but it does expand the criteria. So that is one key shift. And just to clarify too, that it's diagnosis alone does not qualify somebody. It's not sufficient. It really, there is the continued criteria where there needs to be a functional impairment, some certain risk criteria, and consideration of the individual's current level of treatment engagement that are all factored in. Next slide. So it also defined, because the initial language was, not really clear what was meant by being clinically stabilized in ongoing voluntary treatment. And so SB 27 provided us with this definition. And, looking at the individual's condition, is that stable? Are they not deteriorating, or is there some level of deterioration going on, and how actively engaged are they in their treatment? Are they currently engaged in treatment? Are their symptoms being effectively managed through medications and other treatment interventions? Next slide. And so additionally, it streamlined referrals from other courts without the need to file a petition. And while Monterey County doesn't have an assisted outpatient treatment or an AOT court, we do have an LPS court, and we do have our criminal courts, the IST courts for felonies and misdemeanors. And so what SB 27 did was created a more streamlined mechanism and process in place for court-to-court referrals that didn't exist before. Next slide. And so you can kind of see through here that a referral can be deemed a petition Care court judge will review that and can deem a referral from one of the other courts as a petition. And if they choose to accept it, then they will notify that referring court that it has been accepted as a petition. If the care court judge does not accept the referral as a petition, then there's other mechanisms in place to order the appropriate petitioner candidate, whether that's behavioral health or the public guardian's office, for example, to follow up and do some things, investigate, look at the appropriateness, and report back in 14 days. So it tightened up that process and kind of created that more streamlined process.
Melanie?
Yeah.
Can I, Melanie, I'm sorry. Can you do me a favor, and just because Supervisor Church and I are new,
Sure.
the acronyms, if you could, like you did with the AOT, Assisted Outpatient Treatment, if you could just name the acronyms that you're
Of course.
referring to, so
My
we're not
apologies.
completely lost.
My apologies, yes. So
Okay.
when we're talking about MIS, we're talking about misdemeanor incompetent to stand trial. And when we're talking about FIS, we're talking about felony incompetent to stand trial cases. So those would be cases that would be heard in criminal court process. And again, care is civil, not criminal. So it created this pathway for folks who are going through criminal processes or felony or misdemeanor incompetent to stand trial processes, and creates a pathway for that criminal court to refer it over to the care court civil process.
Great.
And LPS conservatorship is our Lanterman-Petra Short Act that oversees conservatorship, which is also a civil process. So you have care court and LPS, which are civil processes, and now it created a pathway there for referrals that could come from LPS to care, as well as from the criminal side through the criminal courts for felony and misdemeanor incompetent to stand trial matters. And so this just really outlines a little bit more in more detail and authorizes, county behavioral health and jail medical providers to share, gives that authorization to share medical records and other relevant information that can assist with the determination. So it clarified some things. Next slide. And again here, the felony incompetent to stand trial referrals to care have always been provided for in the penal code, but it created that pathway for the misdemeanors that kind of mirrors that. Okay. It also provided these additional clarifications here, expanding the scope, who can assist in signing the care affidavits. Initially it was just, the physicians, and now it's expanded to nurse practitioners and physician assistants. So it just updated some of these categories, and clarified, some of the other processes and the court's role in graduations and things like that. Next slide. And so now I wanted to just, share a little bit of the data now that we're, again, 15 months in. The data on this slide, though, we cut it off at February because we're still in March, and we had to, get this presentation submitted and things. But from the start of care court, from December 1st through the end of February of this year, so December 1st, 2024 through February of 2026, we've had a total of 33 petitions filed. That first month we had a couple. In calendar year 2025 we had 24 petitions filed. And in January through February of this year, we've had 7. This month, I was checking with the team yesterday, and we have 4 this month with another one pending. So we might be looking at another month where we get 5 petitions coming in. So the numbers are going up. And if we want to, you'll see there's, we've had 16 dismissals, we've had some that have resulted in that sort of more voluntary care agreement. We've had one that's resulted in a care plan to date, and we have, about 8 more that are still currently in process. And Cassandra will walk through a little bit more detail about the process and some of this stuff here in a bit. But next slide, please. So I just wanted to map this out in terms of the care petitions by month. I find this visual helpful because it kind of tells us how we're trending. We did get off to a little bit of a slow start with, December, that first month, only a couple and no petitions in January. But then as you can see, as we've gone through the last calendar year, from October of last year to date, we've really seen those numbers trending upwards, which is helpful to us in terms of informing, staffing, because Care Court is a very staff-intensive program. There's a lot of responsibilities that fall on behavioral health, a lot of tasks that we need to do here, and so it's very helpful for our planning. And care can be quite a long process, a lengthy process. And we'll share a little bit more about that here in a minute. But I do just want to pause at this point because there was, some media attention from the governor back in, when was that? March 2nd. Press release, press conference in Alameda County where Governor Newsom really announced that, there was this, counties were going to be measured as to their success by the number of petitions that are filed. And, I do just want to acknowledge that. I know there was some local attention to that here as well and interest in that. And so that was really the first time, so earlier this month was really the first time that counties heard that a measure of a court's, success for Care Court was by the volume of petitions. Because traditionally how we work in behavioral health is, our goal is always voluntary engagement, right? And least restrictive environments and trying to engage. And how we as county behavioral health have always viewed this is another engagement tool, another tool in the tool bag. And so with the goal, and it was even written into the statute, right? Like that a care petition would be dismissed if through this process there was voluntary engagement. So that is really the intent, is to get people connected to care and services. And so, looking at this slide with the trend upward, Monterey County was identified as a care ICU court, or a care improvement and coordination unit cohort court. And so we have been in conversation with the state, with Cal HHS, and sharing what we're doing, sharing the good work that we're doing, and anticipate a site visit in a couple months or so, and more information can be provided to the board at that time, as that planning effort is just starting here. But really, we look at the measure of the program success really by our ability to engage people voluntarily, and the successes in the lives that we see that we're changing, and how we're helping folks go from very unstable situations to more stable situations. And I also would say, if we just included our all-in numbers, not just calendar year 2025, which is what was put out on the Governor's Accountability website, we're actually above the mark, and we have a way higher per capita rate that would kind of take us out of this ICU cohort. So I think it's just in how the data was looked at, and that there's a little bit larger picture and context here that I just wanted to share. Because if we looked at the total number of petitions for the population, we would be up at closer to 7.9 per capita than where we were just looking at the 5.5 level of petition. So in reality, yeah.
Can we ask some questions about this sort of at this point in
Sure.
the presentation?
Uh-huh.
Supervisor Church, did you have any questions at this point?
Not at this point.
Okay, I'm gonna just ask a couple questions. Are there any repercussions from the governor's sort of a declaration that we're underperforming? Or was it just sort of a statement that he made?
He did call out the care champion counties and the 10 care ICU improvement and coordination unit cohort counties or lower performing counties. There was statement in the press conference about consideration of taking away funding or whatever from underperforming counties and redistributing it to other counties. But that was just a statement. We haven't received any correspondence that that is actually what is going to happen. What has happened though is Deputy Secretary Stephanie Welch from Cal HHS has reached out. We have been in contact with her. She's very interested, as is Secretary Johnson, in what we're doing here locally at Monterey County, and they have expressed interest in having a site visit to meet the partners, meet our partners and hear more about our program and what we're doing. And there is a tailored technical assistance that the state is offering. And so we will be, again, we had an initial call. And we are just starting those planning efforts, and so as this proceeds, we will definitely report back to the board when we know more about when that site visit would occur.
Well, if it's helpful, I am very appreciative of the way in which it sounds like you are measuring success versus what they are measuring success by being the total number of petitions filed. If we could go back to slide 14, I just want to understand a little bit better what progress we've made in Monterey County, or what this slide actually means. So it's 33 petitions filed, 16 dismissals. Does the dismissal mean that somebody, a petition was filed and then the individual decided they did not want to be part of the program? Or is it something else? Or is it the judge that says, no, you don't qualify? What is a dismissal?
That's a great question. And actually, I think that's something that I'm gonna have Cassandra really walk us through with another visual. If it's.
Okay, then
if it's
let's
okay.
stay here then, before she does that.
Okay,
Because I do want to understand care agreements and what that means, and then what plans mean. And then the last thing I want to ask is, it sounds like if you were measuring success on petitions filed, that in 2026, with some of the SB 27 changes, that we are actually going up.
Yeah.
Is that accurate?
yeah.
Just in the first
Yes.
2 months data.
We've trended up since October of last year, actually, even before the SB 27 changes went into effect. We started to see more petitions being filed. And yes, so we are now sort of, if we look all in at our numbers per capita, we're actually above that ICU cutoff and above the state average for petitions filed.
Okay.
And to
Well,
answer- oh,
yeah,
I'm sorry. I was going to
No, no.
answer your question about care agreements and care plans. Care agreements are when they, and Cassandra can feel free to jump in here, but in essence, they're more voluntary agreements and engagement with the care participant or care respondent around their treatment needs, what they want to work on, and it's more voluntary in nature. The court can order a care plan anyway, and approve that, but there's just a different level of voluntary nature, if you will. That's a little different between an agreement and a plan.
Got it. Thank you.
Sure. Next slide. No. Okay, so just to underscore the voluntary nature of how we engage with folks, we also have a number of full-service partner clients and full-service partnerships and things.
And Melanie, just on abbreviations, when you get, if you could explain those.
Yes.
Thank you.
So I'm actually going to make sure that now we transition it over to Cassandra to walk us through some additional data points here, as well as share more about the care process and insights and lessons learned from the first 15 months. But just as we transition that, again, DSH is Department of State Hospitals, PG, PAPC is our Public Guardian, Administrator and Conservator's Office, and CDCR is the State Department of Corrections and Rehabilitation. So, Cassandra?
Okay, good morning. So we have many sources for care petitions. Behavioral Health has filed 9 care petitions. Department of State Hospitals have filed 9 as well. 7 from family members, 2 from the Public Guardian's Office, 2 from Natividad Hospital, 2 from CDCR, 1 from interim, and we have 1 criminal court referral. So some reasons for dismissal. 7 had LPS conservatorship filed. We had 1 transfer to their county of residence. That was actually very successful. They left Monterey County Jail, and we were able to link them to their behavioral health county and their care court team. We had 2 participate in voluntary engagement. 1 did not meet prima facie. 3 did not have a qualifying diagnosis. 1 we were unable to locate. And then the other is specifically the dismissal was for an individual who was at Department of State Hospitals receiving treatment as an offender with a mental health disorder, and they were not released to Monterey County. So what does the care court process look like? It's a large process. So in order to start the care court process, first we must receive a petition. It has to meet the legal requirements. Additionally, we have to find and serve the client, building rapport as well. In situations where someone other than county behavioral health files a petition, behavioral health is substituted in as the petitioner at the initial court appearance. Individuals can exit out of the care process in several different forms, as you can see, including voluntary engagement, in county treatment services, and then up to including graduation from the care agreement or the care plan. And the care agreement and the care plan are documents that specify services to support the respondent's recovery and stability. The care agreement, as Melanie mentioned, is a voluntary agreement. If a care agreement is not reached, the court can order the creation of a care plan. Additionally, there are status review hearings throughout this process to review their progresses and challenges. And as we're moving forward this process, the treatment team is constantly looking at what services the client needs in order to be successful. And each agreement and care plan is specifically tailored to the individual client based on their needs at that time we're seeing them. Overview of the care court process. So there's a lot of due process built in, and just to demonstrate, it is a really heavy lift for behavioral health. With serving clients with their court reports each time they're attending court, getting them to court over in Monterey. The majority of our clients live all over the county. Okay, next. So it can take time to engage the respondent and get to the actual treatment phase of care. This can be up to 5 to 6 months before we're actually they are kind of brought into the process, building rapport and engagement with them before we can, get to the actually status review hearings. And again, it's just based on the individual and what they're needing at the time for services. Okay, so some of our successes, we've had increased collaboration with the Public Guardian's Office, County Council, our court partners, including the Public Defender's Office, Parole, Veterans Administration, Veterans Transition Center, Monterey County Jail, and our SUD, Substance Use Disorder, and Mental Health contracted partners. It also provides support for mentally ill individuals transitioning from jail to treatment and housing. So we've also seen a reduced repeat of parole violations for technical issues like not being able to charge their ankle monitor. It assists families in creating stable housing and improving family harmony for both the individual and their loved ones. It helps individuals transitioning off of conservatorship to remain stable and demonstrate voluntary adherence to treatment. The care process involves repeated engagement with behavioral health providers, which often helps link even resistant individuals to becoming more open to treatment over time. We've had 2 care participants who have been appropriate and are actually living in behavioral health's Hope Housing Program in Marina. And we have 1 additional referral pending who should be moving in any day. We've also had 3 clients who have been connected to boarding care facilities. 1 receiving crisis stabilization at interim, and 1 is actually being housed at the Veterans Transitional Center in Marina.
And so while we're on this slide, I just want to highlight like the increased collaboration with Public Guardian's Office has really been key, because what we saw initially when CARE went live is we were seeing a petition filed for CARE, and at the same time an investigation was being requested from the Public Guardian's Office for conservatorship or someone under LPS conservatorship. So part of this, because they're very different, was working together and collaborating to see what's really the appropriate level of care for this individual, and to try and make sure that we're getting it right? So collaborating and really keeping the person at the center of the decision making, and then figuring out what resources, what's the appropriate level of care for these folks. So that's also why, you know, we were seeing some of those dismissals and the person ending up on conservatorship, is that there were some that were just in need of more, they had more acute needs and needed that higher level of care. And why Cassandra really called out the Behavioral Health Bridge Housing Program over at Hope Housing in Marina is because it was BHBH funded, so Behavioral Health Bridge Housing funding was used for that. And as part of that, CARE Court participants were to be given priority for housing there. And unfortunately, what we found initially with some of the initial petitions was that they had more acute needs and really weren't at that level to be able to live independently. They needed more support. But now we are starting to see that we're getting some petitions maybe a little bit earlier and more appropriate for you know, more independent living housing in those supported environments in the community.
So some challenges for CARE Court is there's extensive data collection that goes into this. There's no placement for PC 290 registrants. The legal process tasks, which include writing, preparing, and serving legal documents, arranging transportation to court, it's very time consuming, and it reduces the amount of time that can be spent on treatment specific services. There's the addition of the SB 27, which does streamline the criminal court process. It's a resource intensive program in terms of staffing. We have 7 staff with different classifications who are all cross-trained with our adult justice involved population. However, they're also helping other programs as well.
Good morning.
And have you just tell us what PC 290 registrants, you might have just said it, but I missed it, what that is.
Registered sex offenders.
Got it, thank you.
Good morning, Chair Daniel, Supervisor Church, Fabricio Chombo, Assistant Bureau Chief. And I just, we added a slide for funding, but this really should be part of the challenges, because when we look at the funding that the county has received to date, there was an initial startup allocation of $328,604. And that was part of the Assembly Bill 179 that essentially allocated funding to counties based on population. So the funding that was supposed to be used for initial startup costs. And then since then, the state has allocated additional funding. So for this fiscal year, we have approximately $32 million statewide for CARE Court activities. And so you can see at the bottom the activities that are funded with these dollars. And essentially what we want to highlight is that to date, Monterey County has received $38,000 of this funding. So when Melanie made commented earlier about some of the fiscal risks about this, that is essentially what could be at risk if we remain under that ICU level at the state. Yep.
And so with that, there's, the Care Court website, through the court self-help website, our own behavioral health website with additional resources and information. Behavioral health is working really closely with the self-help center as well. We have staff co-located in the building here at the Salinas Self-Help Center. So if there are families or people going in curious about this process, we have staff that they can be connected to that can help explain. On our website, we also have set up a way that our partners, whether that's hospital partners or first responder partners, can refer folks or send information over in a secured way to us to follow up on. Because while anybody, the net is very large for individuals who can file care court petitions, the reality is some folks may not have all the information that they need to do that. So we've tried to create these pathways where, okay, if our first responder partners are having these repeated contacts with folks but may not have all the information that they feel they need to file a petition, they can flag that for us, reach out to us, provide us some information, and then we can take that as staff and follow up on it. And if it's appropriate to file a petition, can do that on their behalf, essentially. And with that, we'll conclude the presentation, and we're happy to answer any questions.
Thank you. Supervisor Church, do you have any questions?
No, I do not this time.
Okay, I just have one. Thank you so much for the presentation. This was very helpful. I feel like perhaps as supervisors, we can be helpful with the compliance issue, only because I don't want us to be unable to receive any future funding that might be available. So what, it sounds like you were going to have the agencies come here for a presentation or to visit Monterey County. Can you continue and tell us more about what that plan was?
Sure, yes. Deputy Secretary Welch and Karen Lincoln, who I don't know, I think I did forward them the meeting invite for today in case if they were able to join and wanted to hear an update. But the state has reached out to the 10 counties on the ICU list and are planning county site visits to come to those local jurisdictions to meet with the teams, with the partners, with the courts, and hear more about our program, the implementation, sort of all the things that we're doing here at the local level. And with the intent of providing some, input and technical assistance, if they see that is needed for the program. So I really look at it as an opportunity to share all the good work that we're doing and to help provide that larger context that maybe isn't represented in, just a number on the state's accountability website. So I see it as an opportunity to share and to have them get to know County Monterey and all our strong partnerships, because we have some really solid partnerships here, and we have implemented a lot of different programs. And I know we have some of the partners here, with us today, which I think speaks volumes for that, if they show up.
And it seems like that increased collaboration and the partnership is one of the successes. One of the measurements of the success is just not the measurement that the state is utilizing. And so I also don't know if there's any attempts being made in the legislature or via anyone even letting our own legislative caucus know that the way in which success is being measured by the governor isn't an accurate measurement from our perspective in terms of the work that we're doing. And so I wish you a lot of luck with the deputy secretary, and let us know if there's ways that we can help. Obviously, we all have very good relationships with our legislators, and we're happy to set up any sort of meeting that might help them also become more aware of Monterey County's work in this, and how we can have them sort of help advocate for us as well, so we can get off that list.
Thank you so much, I really appreciate that.
Melanie, Supervisor Daniels, just to also give you a little bit of an update, this is Michelle Rudin with the Public Defender's Office. I recently did a presentation for the California Public Defender Association with Deputy Secretary Stephanie Welch and Karen Linkins. So they are aware of the training that we have and what we can offer as well for our defenders and the partnerships that we have developed. So during that meeting, Ms. Welch had indicated, yes, they are re-examining what it looks like to be on the ICU list and the 10 best list. And I know that that's something that will be discussed during the site visit, yet our partners are now intimately aware of the training resources that we have for our folks as well.
Great, thank you so much. Okay, well with that, should we go to public comment on this item? Is there anyone with hands raised?
No hands raised.
Is there anyone in the room who would like to make public comment? Okay, well with that then, I really thank you for this presentation. Is the next step something coming to the Board of Supervisors? Or is this a presentation that was just for this committee?
We brought it to this committee, and then typically, in the past, what has happened is that we present an item here that the chair and vice chair feel should be brought to the full board, then they can make that recommendation, and then we would move forward with scheduling that for a full board presentation. So I would defer to you and Supervisor Church on what your recommendation is, and if you'd like us to do that, we're happy to.
I think my recommendation, and Supervisor Church, you can let me know what you think, is that maybe we allow for you to have that engagement with the Deputy Secretary, so then there is some more information to share. It would definitely be beneficial to get the SB 27 update and also just to get this update, but maybe waiting to see how those engagements go first. And so, and present after that. I don't know how that sounds to you.
That's fine with me.
And that sounds,
Okay.
that sounds fine with me as well, because again, I think the dates that they were proposing for a site visit, well, they haven't landed on a date yet, but it would be sometime possibly in May, so we can
Okay.
plan to come to the board after that.
That sounds great. Okay. Well, with that, then, thank you very much, and we will move on to item 5, which is a presentation on standardized homelessness response system performance benchmarks and outcome goals. And this is being presented to us, Let's A, as well as supporting the CAO homelessness strategies and initiatives division's recommendation to incorporate standardized performance benchmarks into all county-funded contracts related to homelessness interventions and provide direction. And it's Dania Valdez, Katrina McKenzie, well, it's both of you, Dania and Katrina.
Supervisor Daniels, before we move into the next presentation, just a reminder that I'm aware that both of you have another committee meeting in this room at 10:30. We do have a pretty full agenda, and we
I
Make
will
sure that we
try
do the
to
items.
not ask as many questions, but I cannot let it pass that in District 5, I struggle very much with the Bixby Bridge and all of the visitation on the Bixby Bridge. So what I would just say to our wonderful next two presenters, if the Bixby Bridge doesn't have anything to do with your presentation, let's find another image. And I'm sorry to have to be the one to say that, but I am tortured.
I have one question before we start on this.
Yes.
We're talking about a 5-year plan, but when I look at this Leave Me Home Plan update here, it says July 2021 through June 2026, and on the front cover, and I'm just not quite sure why that date is on there. If we're talking about 5 years, are we looking back on the 5 years, or are we looking, is that?
If I may, hi everybody, my name is Katrina McKenzie with the Coalition of Homeless Services Providers. We're the lead agency for the continuum of care and also initiate the 5-year plan, and we're under development of reporting out for this past year and the development of extending our 5-year plan to start the development of the next 5-year plan.
It's a little better explanation for me, thank you.
Okay. So good morning, Letty Valdez. I'm Management Analyst with the Homelessness Strategies and Initiatives Division. And as Katrina introduced herself, she is the Executive Director of the Coalition of Homeless Services Providers. So we will be presenting the Standardized Homelessness Response System Performance Benchmarks and Outcome Goals. And just to provide some background, in November of 2024, our division partnered with the Monitoring and Evaluations Committee of the Leave Me Home Continuum of Care, which includes representatives from City of Salinas, the Coalition of Homeless Services Providers, Department of Social Services, direct service providers, and also people with lived experience. The county contracted Egypt Colony Consulting to assist the committee with the development of standardizing, monitoring, and evaluation protocol. So Katrina will now provide more information on these benchmarks and the outcome goals.
Thank you so much, Danya. So sorry about the image.
So I am so apologetic for even saying anything. The bridge is symbolic for all of our work. We'll just find a different bridge.
So Daniel went over most of this slide real quick, and just want to just further what she said, that like these benchmarks or these efforts really mark an important step in enhancing our accountability and increasing transparency and ensuring measurable outcomes across county-funded homeless programs. For my side, I might also include continuum of care. We have met with, like Danya said, the city, the county, and the coalition to align our funding stream so that we are able to the same things of our organization and hold them accountable equally across the board. So this slide really highlights the data review and discovery process and integrates multiple sources, including the Leave Me Home Plan, the HUD Systems Performance Measures, California Systems Performance Measures, local metrics, HMIS, or the Homeless Management Information System, which is ran by our office, and all that program data to create a comprehensive and aligned approach to evaluating our system's performance. And here in this slide, these outcomes are the recommended updated performance measures and benchmarks that is proposed to be implemented across our homeless response system, and how they can align with the Leave Me Home Plan goals are, as it's VOC, that is VOC led, and county adopted regional strategy to reduce and end homelessness. These benchmarks are not created in isolation. They are informed by multiple layers of accountability, best practices, including all the measures that I referenced in the last slide, which is the HUD Systems Performance Measures, California Systems Performance Measures, our local performance expectations, and those are drawn from various requests and proposals which set clear standards for providers who are receiving funding. Oh my goodness, I'm so sorry. This thing looks like it's timed. And then looking at our HMIS data, our annual performance reports that look at program level data across all project types, which is street outreach, emergency shelters or interim housing, rapid rehousing, and permanent supportive housing. Together, these sources inform the benchmark shown here, and they reflect what a high-performing system should achieve, which is quickly moving people into housing, minimizing returns to homelessness, increasing income and access to benefits, and maintaining high data quality and system accountability. By aligning these local provider performance with these federal, state, regional standards, our Leave Me Home Plan, it ensures that our system is data-driven, outcome-focused, and accountable, This ultimately improves how we serve individuals and families experiencing homelessness in our community. So together, these benchmarks help us understand not just how many people we serve, but how effectively we are in helping exit homelessness and for folks to stay housed. So I'm going to pause here for you guys just to take a further gander at what we have developed here through our monitoring and evaluations committee and our consultants over the past year and a half.
So being new to this committee, I'm trying to understand this and how we're moving ahead forward. And I know that we're looking back onto this, but I'm not quite, some of the goals that were set here back in 2021 on reducing the homelessness, the homeless population is higher than what our goals were. Let's say it didn't quite work the way we wanted to achieving all those goals. So I'm trying to look forward, looking here and seeing what we're learning from this and what we're adopting going ahead when I'm not seeing that we really didn't reach our benchmarks. So that's where I'm a little bit, and I'm sorry I didn't explain myself completely in my first statement here. I'm trying to piece this together of what we're trying to achieve here when the last 5 years we really haven't achieved what we really set out to achieve.
Yeah, so thank you for bringing that up. That last, our current Leave Me Home plan was extremely ambitious when we were highly funded. We were in a time of abundance in funding. And we saw the funding and we said, we can do this. We can absolutely do this. But funding pulled back. Program requirements shifted. Restrictions got very harsh. And those benchmarks were really hard to achieve, exiting a pandemic and funding falling. So we did look back at, almost 10 years of data for us to really come to some sort of achievable benchmark that is closely aligned with not only HUD, federal and state, but our local. We found a happy medium to meet everybody's requirements, and that is not overly ambitious to the point of not being able to achieve. So looking at our current data of our local system, we have, and state and federal requirements, we found the happy medium, and this is what we're presenting today.
Okay, I guess for me is I'm hoping we can have some real successes as we go ahead and knowing what resources we need to put into this to reduce it down. I'm just wondering how much we've learned from not being successful, having reduced resources available. But thank you for filling me in a little bit onto that. I'll let you proceed on with your presentation, and maybe it'll all fit together a little better here on where we're going to, or what we think we want to head to down the future too. So thank you.
Yeah, well, I was go ahead, Kate.
Oh, I was just going to say, no, Kate is fine. So I wanted to provide some context or maybe you can provide some context in terms of who the Coalition of Homeless Service Providers is, because with all of the tracking that you're doing, each of those individual entities have seen successes. And so, as the way that you're measuring it is important. But also, when we think about system exits and we think about population size changes, when we think about who we're serving, each of the individual partners have achieved some success in a larger population or in a larger context that as a whole, we haven't met the targets that we set out necessarily, but there are successes within that. If you could just elaborate on that. Unless I'm wrong, then that might be helpful to sort of understand.
Yeah, I would agree, Supervisor Daniels. If we look at each organization individually, and we rate them on just that one program, and not even as a whole, but each individual program within an organization, I do see that there are successes taking place. Macro level, looking at Jewel County as well, because this is not just data from Monterey County, this would be a Monterey-San Benito County implementation, but we want to make sure that each partner is buying into it, right?
Mm-hmm.
Macro level, it is a bigger pot to measure. So getting our system aligned would be extremely helpful, because what the coalition is asking for our subrecipients versus the city of Salinas versus the county of Monterey, we're going to see different outcomes because we're asking different things. But because we have come together to align that and start the implementation of that, being that it's contracting season, it's budget season, we're going to start, if adopted, the county would start putting this into their contracts, and we're already going to be putting it into our contracts on the continuum of care side.
I just will give an example, though. In this period of time, there have been 2 shelters on the Monterey Peninsula that have opened up for women and families with children. And so they themselves, I think, have created the interim housing, well, not the interim, but the emergency shelter, and then within their own programs, there have been successes in folks exiting to permanent housing. And so, I mean, there's just to try to remember that there is some bright spots. The challenge is enormous, but
absolutely.
This 5-year period of time, via the coalition, has seen some very bright spots, and that's just one part of the county. All over, we've had some bright spots.
Yes, and I would like to highlight that we have attended now 4 grand openings of some permanent supportive housing programs and interim housing programs to come in just the month of March. So we're really excited to continue to serve the unhoused and work with our network to increase our data quality and quality of service to those clients.
Great. Thank you.
Okay, so I hope, because it's the end of almost the end, that I was able to answer most of your questions. So through this, our recommendation is, one, to have provided this presentation to you all, and for the county to support the Homeless Strategies and Initiatives Division's recommendation to the boards of supervisors, and to direct the county departments to include these standardized performance benchmarks and outcome goals in all county funded projects or contracts relating to homeless intervention. And then Dawn is here to take notes to provide further direction as needed.
Great. Well, with that, let's first, Supervisor Church, go out to public comment and hear what the public has to say.
I'll give it a shot.
Wes, you have something you want to say?
Sure, why not?
I think Wes wants to speak.
Sorry for being both too complicated and wasting your time. Wes Wise, Salinas Monterey County Homeless Union Co-President. I'd like to see some addition of like during a sweep, I guess. How many times have they been driven off of where they're at, like off of Railroad Avenue that just is about to happen. And there is a shelter there as well. So that's in jeopardy. Some more homeless numbers. How many times have people been moved around? How much money have they lost doing that? How much does it cost for them to replace the items that have been taken from them? And how can we legitimize people? We passed around, I'm on the Lived Experience Advisory Director, which is part of the Continuum of Care Leadership Council, which is connected with this as well, a voting member. So looking for a livability license or whatever, just something that like minimal health and safety standards. If it's not a blanket of trash, if they don't have like stolen property in front of them, It's just their property and ground. How can they maintain their personal property and not have it taken away to where they have to regenerate that? Because that actually causes a lot more, and we're not going to be able to solve and get anybody out of it if we're constantly making them start from zero. Their personal wealth is, their family fortune is gone in a heartbeat. And it's really hard. It's very traumatic. And we're not treating our United States citizens as equals, with inalienable rights, their due process. They're just summarily dismissed because everyone's considered a hazard. And that's not okay. We've got, the homelessness problem is a wealth inequality issue. So unless we want to address it like that and support people where they're at, provide services like we did during shelter in place, running water, electricity, let them provide their own housing. Why are we taking away the housing that they're providing for themselves? You can't break the law to enforce the law, yet this is what we do constantly. Real property or personal property. So where's the balance? Because there are human lives at stake and they are our constituents. And if they did stay somewhere, they'd be able to register to vote and run for office and also help alleviate these symptoms, by causing issue to address these policies. So help me stop sweeps.
Thank you, Mr. White. Is there any other public comment?
I've seen them online, none in the room.
Okay, then coming back to the committee, if you could help me just understand so if this were to move, what I'm looking for is some clarity on exactly what the new metrics are that you would be bringing forward. I mean, we didn't really get, or maybe we did, and you can bring it back, a slide that tells you the new protocol, right? What is it exactly, if you were to articulate it, and can you put it on a slide for us so we know what we're moving forward? I know we talked about HMIS annual performance reports and local performance measures. We have read in our packet the California System Performances measures, HUD's measures. So what exactly is it that you are presenting to go to the board?
Yeah, so.
What is different? What is different from before?
Okay, I see. So before the Leave Me Home, the county or all funders had their own benchmarks and measures that they use for their funding streams.
Yeah.
But this would standardize the benchmarks to ensure consistent expectation across all county-funded providers. Improve transparency and performance monitoring. Sorry, it looks like this thing keeps going. It's on a timer, it's so weird. Improve transparency and performance monitoring and align local contracts with HUD state reporting frameworks. This approach will strengthen counties' competitive positioning in future state and federal opportunities, including HAP, ERF, and other federal resources. In addition, it will support the strategic system improvement identified in the Leave Me Home plan and enable a clearer, more meaningful reporting to the Board of Supervisors and community stakeholders that reflects a shift towards performance-based contracting and outcome accountability. Because historically, performance expectations varied across all funding streams, departments, administration, and contract, and it resulted in inconsistent reporting and limited comparability when you look across the various contracts and types of services, depending on what department it may have come from.
So, and do you feel at the coalition like you have everybody's support, everyone's on board to do this?
It has been approved by our leadership council already to be implemented on the COC side.
Okay, so it sounds like everybody's on board, and it obviously makes a whole lot of sense to me. Supervisor Church?
Yeah, I guess, and this is the problem, I think probably some part of the problem that you're for having the two of your questions, is we're both coming in on this kind of late, and understanding why, you know, these measures are taken over other measures, how successful have these measures been compared to other measures. That's where I'm kind of coming in here, where I mean, I haven't seen that background to where I'm totally, you know, comfortable to say, yes, great, number 5 or 6 or 8 or 10. I completely understand, and I see why that's on here instead of something else that could have been number 13, 14, or 15.
Would it be helpful if you were to see this in comparison to what was proposed or what is
Absolutely.
implemented?
Absolutely,
Okay.
and then also if there's any kind of metrics that were used, why these are being chosen over others. That's what, you know, when I look back at the 5-year report, and I say, wow, okay, we didn't, you know, we're supposed to have reduced homelessness by half. It hasn't happened, and so I'm looking and wondering, well, there's some things that didn't work, and of course, I understand we didn't have resources, you pointed that out clear, but some things will work better than others. I'm assuming these are the ones. That's where I'm just coming from, is it's kind of incomplete to me still, and probably is a great deal with that coming into the meeting here, not having been on this committee before, and so just this kind of in-depth recommendation is what's kind of leaving me sort of with unanswered questions. I think Darby has something up here, Kate.
Okay, yes, Darby.
Supervisors, Darby Marshall, Housing Program Manager. This is something that I brought to the board's attention last year when we did the urban county, and we pointed out that, you know, we're funding the Meals on Wheels, for example, out of numerous different pots. So I think that trying to come up with a standardized reporting system is very helpful. I think something else that we are pursuing that might be equally useful is a centralized grant management system. And I know that HCD has an RFP out right now. And what it would do is, it's the forward-facing tool that we would use to collect grant applications. And it would allow us to collect standardized information in one place and generate reports across departments if we can agree on standardized reporting. And from my perspective and from what we'll present in the next urban county meeting is there are some very different things that we have to collect by statute. But that doesn't mean we cannot be cooperative and come up with shared definitions and reporting requirements so that we can come back to the board collectively. So I'd like to put that pitch out there early, that a grant management system that makes it easy for our subrecipients and our county departments to manage these agreements and collect the same kind of information might be something very worth consideration.
Thank you. That's helpful, and I do think you know, standardizing our reporting systems and, you know, centralized grant management systems, all these things. This is all very good. I think the only question that was brought up is just a need when presenting this to the full board to just have a clear picture of the current system and its shortfalls and moving in this direction and what that will accomplish. But I think you have general support from this committee. I have one question about the public comment, and I'm not sure where the metric would be included or if it's included, but it does sound like there is a desire to be tracking more from the cleaning and sweeps, for lack of a better word, of encampments and personal property metrics and things like that. I don't know where that fits in this, but I've heard over time always, and I've experienced it myself personally when I've been when I was at Gathering for Women, that there is some data there to be collected in terms of personal property. And so if you know or can place where that fits in this, that would be appreciated as to the comment that was made in public comment. And so with that, I think we can move forward. We've received the presentation. I sense support here, Supervisor Church, in terms of recommending we incorporate standardized performance benchmarks into all county-funded contracts related to homelessness interventions. And I think we've given some good direction, if that's satisfactory to staff that made this presentation.
Yes, definitely. Thank you, Supervisor Daniels.
Thank you. Okay, with that then, we are going to move to item number 6. And we're receiving a status report on efforts to construct a housing campus for unhoused parenting youth in the city of Soledad. And with that, it is Darby Marshall.
Darby Marshall, County Housing Program Manager. Back in 2022, the county received a $2 million community facilities grant. This is a congressional earmark, so we have very little latitude in exactly how we use it, but we also have a tremendous amount of rope with which to implement the project. We were directed by Congress to spend $2 million to create a homeless youth, homeless parenting youth parenting campus in South County. We have been working with the city of Soledad to identify an appropriate location for this facility. We think we have finally landed on one. It is property that the city has purchased and is now cleaning up and remediating. Once that's done, we can move forward with completing the National Environmental Policy Act, environmental reviews, and committing the funds. The plan is that we will release the funds to either CHISPA or the Housing Authority, and they will use the funds to purchase the property from the city of Soledad, because the city used park funds, I believe, to purchase the land. Then they will construct between 4 and 6 two-bedroom manufactured units on the site that will provide permanent supportive housing for transitional age youth that are parenting, so this is 18 to 25. We do have Megan Hunter, who is the city manager from the city of Soledad, in the room right with us. She can provide more details on what the city is doing, but that is and what we're looking for now is just guidance from the committee that they're in agreement with this, and that we'll continue to move forward. At some point here in the next 3 to 4 months, we will be going to the full board with a recommendation for probably a subrecipient agreement with one of those 2 entities that I mentioned, the Housing Authority or CHISPA, to actually spend the dollars down. And with that, I'm available for questions. And so is Ms. Hunter.
Kate, you're muted.
I was just saying, go for it,
Oh, okay.
Supervisor Church.
Yeah, there's one question. I mean, this is referring to July 2022, and wondering what's happened in the last, 4 years. That's a 4-year gap, and why it's coming up to us now and not earlier.
That's a very fair question. We've encountered some hiccups, both staff transfer changes at the county side that originally approached the board and Senator Padilla for these funds, and then also at the city's level. We did have a property in mind that we were going to purchase. We had gotten very far down that road, and that imploded. And it kind of sent us back to the drawing board.
Is there a timeline we've got to spend this money on for this?
We have to spend the funds by 2027. So
yeah, well, our backs to the wall then. So
we are
to
getting there, but we should have them expended early in either late this fiscal year or early next fiscal year.
Okay.
I support, obviously, this moving forward, and I will have some thoughts on the recipient agreement, but I will hold those off until we have that full board conversation. Let's go to public comment. Anyone in the room?
I don't know if I give public comment. The city is in full support of this project. We have already acquired, as Darby indicated, the property. It's right next to a park in the city of Soledad, so it's very well situated. And it's in a neighborhood that we intend to invest in quite a bit over the years. I think the city has demonstrated the capacity to be a good partner. We've partnered with the county in executing and building Sendero, which is a 16-bed interim housing project in the city of Soledad. We've already permanently housed 14 residents that lived in the Salinas riverbed, and just we've achieved functional zero homelessness in our city. So that's one bright success that we can point to in terms of cleaning up a 44-unit or 44-person encampment and successfully helping to transition folks into permanent housing. So we're very excited about this. The council is very supportive and is looking, we have seen this need in South County for unhoused parenting youth, and we're very excited to move quickly forward. We're working with CHISPA and the Housing Authority, and we're confident that we can execute this by 2027, as we have demonstrated with Sendero, which we were able to execute in about an 8-month timeline to build that facility. So thank you for letting us comment. I just wanted to also acknowledge my colleague, Beatrice Trujillo, who's our Community and Economic Development Director, who's here too. Thank you.
And thank you, Ms. Hunter, and congratulations on all of this success and the benefits to all of the county. And so, yes, I think you have the support of this committee to move forward to the Board of Supervisors. Is there any hands up for public comment online?
No hands up on Zoom.
No hands up. Supervisor Church, anything more you'd like to say on this item?
No, I'm very supportive of this moving ahead.
Wonderful. Okay, so with that then, we will, do we need to have a motion and a vote on the recommendation of the Board of Supervisors?
Move by consensus if both of us are agreeing.
Okay, moved by consensus, we're good?
Fine with
I just
council? Yes.
Okay, thank you, sir, I appreciate that. And we are now moving on to item 7. Oh wait, is this the same? Oh yeah, also Soledad. Okay, consider a request from the city of Soledad to use permanent local housing allocation funds controlled by the county. And this again is Darby Marshall.
Good morning, Supervisors. Darby Marshall, Housing Program Manager. Back in 2024, the cities of Carmel by the Sea, Greenfield, and Soledad delegated their permanent local housing allocations to the county of Monterey. This was an opportunity that we had to consolidate some relatively minor pots of funding and potentially create a bigger pot of funding that could support a significant affordable housing project. In this case, Soledad, I think over the 5-year period, was going to get about $850,000. Greenfield, roughly the same. And the county was going to get about $3.6 million. This has allowed us to take what we were going to get and push us up north of $5.6 million to support 10 designated activities. The county has used these to support the Share Center here in Salinas, Homeless Street Outreach Case Management, funding for Rock Rose Apartments here in Salinas, which was permanent and transitional supportive housing. We still have about $1.6 million available that is restricted by the state for use to support affordable owner workforce housing. And so this is housing that is affordable to households that can earn up to 150% of their immediate income. It can be used for pre-development, down payment assistance, housing rehab, a whole variety of activities. The city of Soledad has a project that is in search of funding, but is otherwise, once it's funded, ready to go. And they have requested that the county allocate its $1.6 billion of affordable owner workforce housing PLHA funding to their project. Unfortunately, Ms. Hunter and Ms. Trio were at a conference when I was trying to put this together, so I didn't get a lot of the numbers, but they are in the room. They can tell you how many units are proposed, what the affordability levels are proposed. These will be income restricted units for 45 years. consistent with what we do for the county's inclusionary housing program. And the one other thing I would point out is, under the permanent local housing allocation guidelines, when jurisdictions delegate their authority to apply for the funding, they get RENA credit for units produced with the funding in their jurisdictions based on who issues the building permit. So the city will get RENA credit for these units when they're ultimately built, even though the county has invested some of its funds in it.
So Darby, I'm going to ask you to just repeat that. When you say the city gets the RENA credit, are you talking about the city of Soledad or the cities that donated the funding?
The city of Soledad, because they're the ones issuing the building permits.
Okay, got it. Okay, does Ms. Trujillo or Ms. Hunter, do either of you want to say anything further?
Sure, we're very excited about this opportunity to acquire this 4-acre parcel. It's located, Soledad is relatively geographically small, so we're about 2.2 square miles if you take out the prison and some of the other islands that we own, and it's a highly walkable community. This parcel, 4 acres, is actually right next to our best park. It's the first all-inclusive park in South County, and it's just a 2 doors down per se from the Hartnell satellite location. So it's a prime location. It's on Orchard Lane, which is one of our newest built areas where we have a lot of residential there. We have a circulator bus with MST, so it's just and also down the street from some schools. So it's just a prime location. It was meant to be a small lot subdivision. The developer hasn't been performing, and so there's a lot of interest in building more moderate housing, ownership housing that we anticipate for that location, along with some multi-family affordable housing. So we're really excited. There's the original entitlement, so it has been entitled as 37 small lot subdivision homes along with 24 multifamily units. So in total it's 61 units projected for that site. The city has had a great history with housing for workforce. We just had a project called Las Viviendas, which was 104 townhomes that got snapped up so quickly. That was one of the issues with the TABE project. We weren't able to get ahead of it because there was such a high demand for that workforce housing. So we're confident that, again, we can put together a project if we're able to acquire this pretty quickly. And the developer, we have a couple of developers who are interested. We've been in initial conversations with Habitat and Self-Help. So there's some opportunities with groups that do this kind of affordable ownership housing. So, and happy.
Just to clarify, so the way in which you're able to do this would be with like a nonprofit developer?
Yeah, we would, or it's possible that we could work with a private developer. We would have the units income restricted or deed restricted, so based on what the PLHA requirements are. But it's possible, since it's workforce housing, these are more middle-class families, which are really great for ownership because, as I think you know, coming from the peninsula, a lot of folks have been forced out of those areas, and they're actually looking at South County as maybe the last affordable place in Monterey County where you can have home ownership. So Soledad is primed for that because not only are we more affordable for the land, but we also have water and sewer capacity, which I know is challenging in other parts of the county. So we own our own utilities. I should preface that the city of Soledad provides water and sewer in our jurisdiction.
So yet though, with the success of Las Viviendas, was those local Soledad families that,
Yes, there was many in Soledad. There were also a lot in South County, but I will say that we have increasingly had more people from Monterey County that have moved to Soledad because they've been priced out of, whether it's the peninsula or even Salinas. We're finding folks, actually county employees. We have many county employees who live in Soledad.
okay. All the dynamics of the challenge that we're trying to address.
Exactly.
Thank you. So appreciate that. More, yes.
Don't mean to interject. My name is Dani Animitsu. I'm with Housing and Community Development. I actually oversee the PLHA grant, and it's actually affordable for 55 years, not 45.
Oh, good.
So I gave you an extra 10.
Deed restricted for 55 years.
Correct.
Okay, thank you. Supervisor, was there any, so I haven't gone to public comment, I just went to Soledad. Supervisor Church, did you have any other questions or comments?
Yeah, I had some questions onto this. In the summary here, the cities of Carmel, Greenfield, Soledad delegated their PLHA allocations to county. How much did Soledad delegate?
I want to say it was about 850,000 over 4 years.
So this 1.68 million, is that the accumulation of all of them?
Yes, it is.
Okay.
So the way it works, Supervisor, is when the funds were delegated to the county, basically those funds became subject to the county's PLHA 5-year plan and how we plan to allocate dollars. And so Soledad and those participating cities have provided funding for the Share Center, for the homeless case management services, for Sunrose Gardens. And in turn, we're now going to be able to invest back in Soledad. So the money comes in, it gets consolidated and spent on board-approved activities, and then goes back out onto board-approved activities.
Okay. This is going to be used for moderate-priced homes. What's a moderate-priced home in Soledad?
We would base it on the most recent, but I think when we were offering them in Las Viviendas, I am going to turn to my colleague because she will know exactly because we signed many covenants during that time.
So it's determined based on the size of the home and also based on the household size. So I'll give you an example. When we were selling Las Viviendas, it's slightly different, a little cheaper because they were condominiums. So Las Viviendas, for a family of 3 to buy a 2-bedroom, so they will be capped at the income category, the maximum income category at 3. For low income, they were purchasing the unit for $297,000.
So this is a home, or?
This was a condominium, and then we had a 3-bedroom that was getting purchased by a family of 4 within the moderate income household, and that will be in the $450,000.
So are these going to be homes or condominiums?
These are going to be homes. I was just giving you a baseline
Okay,
on our
sure.
latest project. So this will be homes. There are smaller lots. That's what helps keep the price down. So even it's not going to be as cheap as a condominium, but it's going to be more affordable than a regular lot house because there are smaller pieces of land.
Right, and that'll help keep the price. I guess I'm just, yeah, I guess I'm trying to get a idea here of for this project and what the plans are for it in terms of how many homes are going to be going on this. Where we, are you that far developed to this along the way? Do you know how many homes are there? What is going to be the price onto them? How does it relate to what is a average price or moderate income, normal, undeed restricted home?
Yeah, so
How does all that fit in?
Yeah, so for, the property is entitled for 37 small lot single-family homes and 24 multifamily units. Obviously, what we would do is when we acquire the property, and we've just gone through this with another property, we would go out to an RFP process to identify a developer with the requirements of the PLHA funding and with the entitlements. And it may be possible that when they look at the requirements, they may have to tweak the development. But right now, it's entitled with 61 units.
Oh, okay, so really don't know what you're setting out on the price for these units at this point.
I mean, we would have to meet what the deed restriction
And I guess
requirements and costs, which they are a little bit a moving target because it really depends on what the median income is. But I think it's roughly going to be in the 500,000 range based on affordability.
Yeah, I was going to say, I'm not always a big fan of deed restrictions because it caps people's ability for wealth depending on what the terms are, and a lot of people that are able to, buy a home, it's the way that they're able to take care of their wealth and retirement and for their family later on. So it's I understand that it's more economically advantageous than renting onto that because there still is some equity that people are able to build into there, but I also think, if you're planning something I'm hoping to push and raise some more in the next few years, but if you're making, you're making smaller lots, which is one step. If you make smaller, the homes, 2-bedroom homes, that gets itself naturally capped in price as well, because those are not as high priced on the market. But it doesn't sound like you have all those details I want, and that was the one thing I was trying to get sorted out, is understanding how far along you were. But I don't think my questions, I think, are going beyond what you're prepared for.
Right now, I think that the city, I don't think, has even prepared a really rough pro forma yet. And like Megan said, a lot of this is going to depend on what the median income is in 2 or 3 years, and also interest rates. Those are usually the two biggest drivers in how we set the affordable housing price. And then the other challenge, to your point about deed restrictions, we don't really have a choice because that's the requirement that state legislation has posed on using these funds.
55 years?
Yeah.
Okay.
And I think we could reach out and clarify with PLHA on a home ownership product, because we have an inclusionary housing ordinance, and we do have like a equity share arrangement, and I think the county also does in their inclusionary housing. Oh, no, maybe not. But that's something that I agree with you. It's really important to figure out how folks can build wealth, and usually what you can do is the longer they hold onto it, the more that they can kind of actually have that funding, and then the payoff goes into a system where you can build more affordable housing. But we definitely want to ensure that we can provide this housing for the benefit of the county, because like I said, we're seeing more and more people that can't afford in this area, and they're coming down to South County. So.
And just to add a little bit to what Megan is saying, for Las Viviendas, the condominiums that I was mentioning is probably our latest development that had inclusionary housing. I have 2 families that are selling their properties that they bought back in early 2024. They're selling them now because they're growing their family and they want to size up. And even though it was an inclusionary home, they did get a little bit of an equity. So they're using the money that they made to size up into a unit that is not restricted anymore. So for them, it was a stepping stone.
Yeah, no, I understand it can be sometimes. It's a very small stepping stone, sometimes it's bigger.
Yeah.
So I just like that flexibility, but I understand we have state regulations here that limit us what we can do.
Yeah, and we're going through this, as I mentioned. We just are partnering with Eden Housing to build a property that we acquired kind of similarly, and so they are tweaking it. And the great news is, by partnering with them, we're actually getting, the original plan was for 100 units. We're now getting 143 units on that site. So there might be some ability to, once we acquire, to look at even a few more units that we could get on the site.
Thank you.
Great, well, let's, I can't remember if I've asked about public comment. Is there any hands up online?
No hands up online.
And is there anyone in the room who would like to make public comment? Okay, well, with that, I believe we support a recommendation by consensus to the Board of Supervisors. And before we adjourn this meeting, thank you for your patience with Supervisor Church and myself, especially with acronyms. I look forward to serving on this committee, and I hope that we were helpful to all of you. And I think if there's nothing else that anyone else needs to do in this meeting, we can adjourn.